one thing that still holds back prevention and treatment and other advances is unfortunately stigma.
It's this idea that, oh, if somebody sees me with this medicine, then they're going to make an assumption that I am HIV positive, or, I have some type of STI. And it's like, but actually you could be using it for something completely different.
I know the barriers that you face in getting this task done, but girl, you did that. You got it done.
Hello, welcome to the Keep On Loving podcast. It is your favorite Rose, Mystique. I am so happy to be here with you today, and I have my esteemed colleague, Sigfried. Sigfried, can you introduce yourself for us today?
Hi, Mystique. I'm Sigfried Aragona. I am the Prevention Clinical Associate over or the DHH. So I'm essentially the city's clinical liaison to help promote PrEP, and HIV testing in the city.
Well, I'm so glad that you agreed to come on and talk to us today. Today, we're going to be talking about Zero HIV Stigma Day, as well as a new baby that you are working on in the department called Prevention Pioneers. So let's get started. So Zero HIV Stigma Day is a national and international global campaign that really is about thinking about how do we diminish discrimination as well as stigma within individuals who have been affected by HIV, as well as those who are currently living with HIV. So what is your experience with HIV Zero Stigma Day?
I think stigma, unfortunately, has always been a theme since HIV has started really inflicting people in America, especially in the 80s. So I think we've come through so many scientific breakthroughs and so many different useful medications and things and approaches. But the one thing that still holds back prevention and treatment and other advances is unfortunately stigma. So that's why this day is so important, and it should be important every day, because there's people who are getting diagnosed, living and thriving with it, and people deserve to know about that.
Yeah, because you definitely can thrive even if you are living with HIV or any other terminal illness. So for those of you who are out there who feel as though, you have been diagnosed with HIV or any other illness, just know that there are people in your corner here at DHH and other places that will support you through your journey. All right, so let's get into your baby, Prevention Pioneers. I'm super excited because I'm not even going to hold you. I really am a award person. I'm yes, give me the awards for all the things, especially when it's coming from people who know the work that I do, who see me on the ground, literally boots on the ground, right? Mm-hmm. And so I think that it's really important for you to be able to pioneer something, right, that comes from a place of understanding because you've been able to do it too and be able to put it out there. So my question for you is, what does being a prevention pioneer mean to you, and how has it pushed your journey in HIV?
So I would say to be a prevention pioneer is someone who is willing to champion something in HIV prevention, whether that be in a PrEP program, whether it's a dedication to PrEP patients or a specific handling a number of PrEP patients and meeting a certain goal in that way, or being able to pioneer a new syndromic screening protocol in terms of trying to screen collectively for HIV, STIs, and HCV. I think it means being able to take all these useful tools that we have and share that with not only the patients in the community in the city, but also the whole network of providers and caretakers we have here, so we all can pioneer our own ways in our own life.
Listen, so in thinking about pioneering, as well as in thinking about where we are in our administration and things of that, how do you describe where we have come from, where we are, and where you think we're going in terms of HIV prevention?
I think it's so interesting because when you look at the spectrum of prevention, you have abstinence only education, and then you have education that focuses.
It stresses me out.
Oh my gosh, it stresses me out too. I didn't even get it. Luckily, no, but I got the education that was mostly just like using condoms. And then little did I know, there's even there's now medications available, and to me it's really interesting because a lot of the advances are due to people who have been pioneers, people who have begged for information and begged for research and have put clues together and have forced the right people to support them. So I think that's why we have things like new forms of PrEP, like injectables, and we have doxypep available, and we're finding new clinical uses for different medications that can be used for prevention. So it's really good to see, and all kind of rounding it all together. We want to see these providers and to pioneer their approaches with a way that also decreases that stigma.
Yeah. Fun fact, did you know that doxypep can also be used for tick bites?
Doxycycline for Lyme disease is also used for prophylaxis for dentist treatments sometimes.
Listen,
yeah, girl.
Doxy, listen, get you some Doxy, okay? I keep it on standby just for general purposes. Keep it on standby. It works. But I think it's something important about that, because oftentimes when people think about medication, it's like, oh, it's a one size fits all. And it's like, no, it's not. You can use it for multiple different reasons. Or it's this idea that, oh, if somebody sees me with this medicine, then they're going to make an assumption that I am HIV positive, or, I have some type of STI. And it's like, but actually you could be using it for something completely different, right? And so I think that it's important to be able to name that so that people can not necessarily hide their experiences, but also think about other ways that they can go about looking at those situations. And so why do you think it is important right now where we are in the world in general, right? Because the world is on fire. It's on fire here in Philly, but also in general, the world is on fire. And so why do you think it's important to celebrate and recognize people who are doing prevention work with PrEP, HIV, and just in general, I think overall our sexual and reproductive health?
So I would say, people who work in social services, people who work really face to face, especially coming out of the pandemic, or people who have worked through the pandemic still being a person facing, it's often a thankless job. You do a lot of work, you make a lot of sacrifices for people, and you're essentially sometimes teaching grown people how to take care of themselves, and that's a lot of these people's passion, and we need these kind of people in the world. But it's also really easy to get burnt out. It's easy to lose that passion and lose that flame sometimes. I know that sometimes I've seen a little bit of that. It's very natural for that to happen, but at the same time, because we have this whole network of very intelligent and talented physicians, nurse practitioners, pharmacists, social workers, care navigators, we have each other to lean on, and some advice to give to each other, not only in the work that we do, but also just being able to understand the struggle and all the grievances that kind of come with the job, and say, hey, I know the barriers that you face in getting this task done, but girl, you did that. You got it done. And that's the point of Prevention Pioneers.
Listen, I think that it's amazing. So tell me, how do I, get into contact? What do I do if I want to nominate someone, or when is it going to be? All of the things. I need all the details.
Okay. So let's see. Our who, what, when, where, and why. So who? We do have our DHH Prevention Provider Network. However, you do not have to be an existing member in the network in order to nominate somebody or nominate yourself.
I'm going to nominate myself. I'm just putting it out there.
What you do, okay? I want to see it, because I know you do a lot. But yeah, you can nominate anyone in or out of the network, and hopefully, I would like to think that by nominating, we would like to see you in the network, and hopefully get to meet some of us and some of the other people. Where it is at the Doubletree Hotel in Center City by Broad Street. It will be an evening event. Okay.
Okay,
People
it's
fancy
giving
out
black
here.
tie. I
Right,
like it. I like it a
exactly.
lot.
It will be the DoubleTree. It will be October 30th, which is Thursday night, 6 o'clock to 8 o'clock.
Okay.
So that is the Thursday of Prep Awareness Week. So this really is sort of the tail end celebration of Prep Awareness Week after seeing all of the agencies' different events and efforts throughout the week. I think it makes sense to end it with a celebration recognizing what everyone does. So it's going to be, unlike our other prevention provider quarterlies, this one will be a lot more fun, a lot more celebratory. Like you said, dress up. We'll have some entertainment. We'll have some music.
I'm coming to have, I just want to thank me. No, I'm kidding. I'm kidding.
Hello. This is Sigfried Aragona, and Prep Awareness Week is just around the corner, starting October 27th. It is a week lined up of events from your agencies across Philadelphia showing off their HIV prevention efforts and gathering their support and promoting all their services. But it is ending with a night of celebration on Thursday, October 30th at 6 o'clock at the DoubleTree Hotel with Prevention Pioneers. It is a night recognizing star examples of excellence in HIV prevention care. We are recognizing pioneers in oral PrEP, injectable PrEP, syndromic screening, primary care PrEP, and perinatal PrEP. So this will be, instead of our PrEP Provider Quarterly, a night for you to nominate your favorite provider, favorite team, favorite program, favorite agency, so they get recognized for their excellent work and creative approaches to preventing HIV in Philadelphia. Our nomination page will be on our Prep Awareness Week website, so keep a lookout for that. If you have any questions, email preventhiv@phila.gov, but save the date for October 30th at the DoubleTree Hotel, and I will see you there.
So tell me how the nomination process for Prevention Pioneers is indicative of inclusiveness, especially for those who are often left out of the conversation.
So to be a prevention pioneer, we are asking people to submit a nomination by writing a narrative. It can be nominating yourself, nominating someone you work with, nominating a team of people behind a certain program, or nominating the agency as a whole in an example of excellence in HIV prevention. So we're going to have 5 titles, I like to call them, categories, if you will.
5 is a magical number.
5 is a magical number. I don't know. It's one hand. There we go. There's oral PrEP pioneers, injectable PrEP pioneers, syndromic screening pioneers, perinatal pioneers, and primary care PrEP pioneers. So I'll break that down in a little bit, but essentially your narrative will show how your nomination shows excellence in that area. So that can be shown through different data points, patient testimony. And to your question, it's important to us to see that a prevention pioneer is working towards health equity goals and answering to the vulnerable populations here in Philadelphia, particularly MSM of color, Black women, and people of trans experience. So those are things we're paying attention to, and it only strengthens your nomination if you have the data to back it up as well. So all those sort of details to help you will be in a Google survey that will be blasted when nominations will open. So keep an eye out for that.
So who can apply to Prevention Pioneers?
So any provider in the Philly zip code.
Awesome. And they have to be a provider. They cannot be an individual.
They can be an individual, but you're nominating a provider. And when I say provider, someone who is providing HIV service. So that's anyone from a physician over to the person working at the front desk.
Okay.
So happy to accept anyone on the team from the clinic.
Y'all see I'm putting in my bid, right? Because I am that individual. Okay. But anyway. All right. No, that's perfect. So tell us a little bit more about the 5 categories and what they mean in particular.
All right. So category 1, we have our oral PrEP pioneers. So that recognizes excellence in being able to encourage widespread coverage of oral PrEP, whether that's daily pill or 2-on-1 dosing among Philly communities, especially the ones that are most vulnerable. So we're looking for creative approaches to people who have promoted PrEP in their clinic, have gotten patients in their clinic for PrEP, have gotten patients staying on PrEP, linking people to PrEP. We want to see if there's any examples of people who are just really good, like anybody who's good at providing care to patients on PrEP, and any particular clinical techniques when it comes to providing care. We want to see examples of that.
Awesome.
Injectable PrEP pioneers is very similar. However, we're looking at injectable PrEP. Keeping in mind that cabotegravir and lenacapavir have a much different schedule, and they're way more newer medications. This gives an opportunity for us to look for really new and creative, innovative ways people are setting up programs. So I think if you have any kind of injectable program, whether it's new or if it's been, going on for a bit, you probably have something to share because this is such a novel thing. So we'd love to see those examples and see some examples of excellence there. Category 3 would be syndromic screening. It would be to recognize excellence in programs or individuals that facilitate collective screening protocols. So while a patient is there, they get screened for STIs, HIV, and hepatitis C. They get linked to treatment. They get the treatment. And then any follow-up that's needed is also done as well.
I love that. That's awesome.
So yeah, making sure that we're paying attention to all that. And really any side of the spectrum of care, whether it be from care navigation or the clinical side, we'd love to see what excellence means in your practice. And the last two focuses on HIV prevention and PrEP in some more general settings like primary care. There's this misconception that you have to be a specialist or an infectious disease provider in order to do PrEP, but PrEP is honestly a pretty manageable medication on the clinical side. There are readily available resources with guidelines for primary care providers to feel like they can safely do so, provide that care and follow up. And also you have the DHH and me to help you out and provide some technical assistance. So, and then we know that there's also primary care providers out in the city that are doing a great job in providing PrEP despite them being primary care providers. So we want to see what it was like to get the buy-in for patients, if it was hard to sort of find PrEP patients, if there was difficulty in your team to sort of get PrEP going. How did you overcome that? We'd love to see that. And perinatal prevention pioneers is pretty similar, but just on the perinatal side. So OBGYNs or people who are working in that field, any side of that care spectrum, we'd love to see how you are promoting PrEP and HIV prevention for people who are getting pregnant and are pregnant.
I love that. That's amazing. I feel like you have thought of every person, group, individual, organization that is working in HIV prevention and navigation and care. And so I'm excited. So if you're out there and you feel like you fit the category, any category, please apply.
We want to know who you are. Who are the movers and the shakers?
Yes.
You know?
Because once you win one award, the rest will keep coming. I'm just saying.
I like that mindset.
I'm just saying, All right. So what advice would you give to someone who is thinking about possibly applying, but maybe is a little nervous? They don't feel like they have what it takes to share their narrative.
That's fair. I like that question a lot, actually, because it's kind of like, where do I start with this? I would say, first of all, what programs make sense? What titles make sense for you? Are you working in a perinatal, in the perinatal field or primary care office? If not, then you probably won't apply there. But if you're talking about, an injectable program you have, HIV testing, or oral PrEP program that you have, think about what the strengths are and think about what sort of data or, evidence you have to round that out. So on the nomination sheet that we'll be blasting out, it will give a kind of a list of details of things that will strengthen your nomination. It's a long list. You absolutely don't need to include all of it. It's just there sort of a guideline of things for you to sort of collect that might help you to sort of write things out. But it's going to include things like quantitative data. So how many PrEP patients do you have? Like development of a program over time. So if you started from point A of an injectable program and then and now you have 30 patients over a year, I'd love to see that.
Mhm.
What kind of collaborations do you have? I know sometimes there's a lot of partnerships with pharmacies. We want to learn about that. And really giving us the full scoop of if someone wanted to be excellent in oral PrEP or injectable PrEP or syndromic screening, like what does that look like based on your work?
Awesome. All right, Sigfried. Well, thank you so much. It has been a pleasure in talking to you. I can't wait to see what comes of Prevention Pioneers, because once the first group is out, then they get to influence the next group and so on and so forth.
That's the goal. Exactly. We will see you there. Save the date, October 30th. Doubletree 6 to 8.
In your flyest
Yes.
attire. Be there.
Casual black tie.
Casual. I'm coming. I'm telling you, I'm coming with my gown and all of that.
I was saying, I'm getting glam. So
yes,
okay, cool.
It's going to be, And remember, no matter how you're loving, just
keep on loving.